So thank you very much, Dean Galea, for the invitation. It's really exciting to see the kind of work that's happening here. I also want to say how humbled I am to be amongst this very distinguished panel, and I want to just go ahead and jump right in. So my orientation to this panel is as a person who's working in and having founded a center focused on racism that's housed within a school of public health. In my remarks, I'll discuss this center, provide a little background on it, identify just 3 types of policies that I think would enable such a center to thrive, and then conclude by introducing what I believe are some important sticky tensions that we must address. I come to you from Southern California on lands originally inhabited by and cared for by the Gabrielino Tonga peoples. I think about this every day and what it means to come to my work with an anti-racism orientation as a woman who identifies as the descendant of slaves from the U.S. South, and think about the many ways in which we who even those of us who are fighting against racism in all its myriad forms still benefit from the historical and ongoing injustices visited upon the indigenous peoples of the Americas. And I think it's important to always bring that into any conversation that I have. So the Center for the Study of Racism, Social Justice, and Health was established in 2019 after a number of years of work towards that goal. And the goal of the center really was to create an intellectual home where folks who were already doing work around racism and health, as well as those who were wanting to do this work, could come together in order to build the integrity and the rigor with which we carry out this work. It's among the first centers of its kind to be housed in a school of public health, and it's developed based on the public health critical race praxis, really developed based on a grounding in critical race theory. The mission of the center is to advance rigorous research, innovative teaching, and community engagement around racism and various forms of social injustices in order to promote health equity. By many standards, we have been far more productive than I originally anticipated, in part because my original vision was for a small, relatively small center. But the need is great, and there is considerable interest and readiness, I believe, to address racism within public health and more broadly. Just to give you a sense of the kinds of activities in which we engage, we are routinely, just if you think about like a typical week, conducting our sponsored research, so the NIH work has to get done, responding to requests for information about racism as a public health problem from schools, elected officials, from students, from community members, from colleagues, supporting community partners in their ongoing efforts. Those efforts may or may not be specifically tied to health equity as we in public health might define it. But remaining committed to them means supporting them in the work that they're doing. Planning and hosting speaker series, supporting our affiliates through activities such as journal clubs and book clubs, for instance, the Anti-Colonialism Collective Book Club, which was started by a doctoral student, Anna Michelle McSorley, in alignment with her dissertation work. And Anna Michelle McSorley is one of the doctoral students who recently graduated, our first large cohort of doctoral students to graduate from the center, and is now moving to New York University. And her dean is here in the office, in the symposium right now today, where we're looking at now how do we bridge the work around anti-colonialism, knowledge production around anti-colonialism, public health practice around anti-colonialism across these 2 institutions, and then certainly mentoring students. The question on which I have been reflecting in preparation for today's conversation is, what does it take for anti-racism centers in schools or programs of public health to thrive? And what I want to offer is just 3 policy considerations. I agree with much of what we've heard today, and then these sticky tensions. Very briefly, anti-racism has been defined in a number of ways, and I don't need to say that for folks who are here at Boston University. But very simply, I will just say we can think of anti-racism as a commitment to dismantle racism across all socioecologic levels. So the first kind of policy I would say we need is policies that change the incentive structure. And this is important to increase the benefits of faculty engagement in particular in unconventional or risky equity-oriented endeavors. Let me contextualize this by saying that I have spent my entire career focused on racism as a public health issue. And it's wonderful to have great support for that work over the last 2 years. But much of this work has actually been done walking against the grain of the field, not walking with the field. And so there has been little support for people who are trying to do that work, both in terms of actual financial support, but also even being able to see the work as relevant to what the rest of the field is doing. It's important to consider both financial and non-financial incentives, and it's important to count the invisible labor that Black, Indigenous, and people of color folks do, and other folks do, to make this successful. It's important to have policies that supply resources according to need. And here I'm thinking about the way that former president of the American Public Health Association, Kamara Phyllis Jones, defined equity as assurance of the conditions for optimal health for all people, and went on to explain that to achieve equity, we must value all individuals and populations equally, recognize and rectify historical injustices, and provide resources according to need. So in terms of centers thriving, at issue here is the tendency of policies to advance the interest of marginalized groups, right? So to address issues of inequities within institutions, but to do so primarily when it's going to benefit non-marginalized groups. And what that results in then is a continuation of the disparity, or at least it has the potential to. And finally, we need policies that reframe what equity, diversity, and inclusion are. Can we move away from the tendency to view BIPOC people through a deficits model? Can we move away from the tendency to treat BIPOC people as, and I think this is related to the first point, perpetual mentees? It's different to relate to the institution as a junior person of color, but what does it mean to respond to or to answer to a senior person of color in the institution? Can we move away from the failure to call into question how privilege is operating? And you can see these 3 points are related. As long as we continue to frame the problem in terms of disparities and lack of diversity being about the need simply to help the disadvantaged, I'll use that kind of framing, we will fail to recognize the relative ways in which privilege is at work. And then can we move toward establishing policies based on perspectives that may be unfamiliar because they originate among marginalized populations? Can we move towards supporting work on health equity as well as work on institutional diversity? These two are not synonymous. And then can we support work that advances both? And I believe that if we do that, we can really advance both. There are some sticky tensions that I really only have time to just quickly list here. And they include And these are really tensions. You know, you can think of them as a tug of war that we need to grapple with, and that going into the development of a new center, I would recommend having great clarity about where one stands and what the center is trying to accomplish. The first is recognizing this tension between the role of institutional service versus the role of research and scholarship. So the big danger here is that people who are seeking to advance their research and scholarship may end up in an environment where they are reduced to doing Racism 101 sessions, which does anything but advance and deepen their scholarship. So there's a real danger in terms of actually advancing the knowledge. It's important to think about the tensions between creating a safe space versus an intellectual space. Ideally, we want both in one space. The truth is that in the current societal context, we must consider the ways in which safe spaces for talking about racism can be, spaces that are intended to be safe spaces for talking about racism can actually not be safe spaces because they're motivated by a variety of interests, including access to research funding, the desire simply to study racism disconnected from the hard work that many others come to the work with. So a secondary question then is, if we decide that this should be a safe space in which the intellectual work can be done, what does it mean to try to enforce safety in a space? And there are a variety of things to keep in mind, including, for instance, legal considerations. Another set of sticky tensions arise when we think about the aversive forms of racism that are salient in the early 21st century, according to critical race studies. There are a number of tensions regarding public-facing versus institutional roles and responsibilities of these centers. Sticky tensions regarding the stakeholders to whom the work and the affiliates in the center are most accountable. Is it the funding source, or is it those who the communities that would benefit from the work? And finally, there are a number of sticky tensions related to tokenism and going into circumstances where tokenism we might well know that we're being tokenized, but can we do some sort of cost-benefit analysis based on things like balancing tokenism versus the perception of not being collegial or a team player, gaining from the benefits of increased visibility, but there are also a number of cons to that, and the need to engage in truth-telling versus the tensions that arise with tokenism. So I will conclude simply by saying that this is a critical moment as the number of centers in schools of public health and elsewhere is increasing rapidly, and it's important if we want to think about sustainability that they have the substantive support needed to stay there and to be effective over the long haul. If anti-racism centers are to thrive, institutional policies must change the incentive structure for engagement, supply resources according to need, and reframe EDI. I think that the sustainability of these centers will ultimately hinge on clarity, the level of clarity, and ability to adhere to and address these sort of sticky tensions. Thank you.